Question. Jordan is a student from Scotch Plains. He has the next question.
Hi, Senator. Thank you so much for being here. My question is, why do you believe that the government can provide better health care than the private sector, and why should people who like their plans be forced to switch?
Okay. First of all, let's be clear what we mean by Medicare for all. Okay? Medicare is a government-run program for seniors, which is widely popular and quite effective. In 1965, when Lyndon Johnson passed that bill, it was called by some Republicans socialism and everything else. But you go to the average senior and you say, how do you feel about Medicare? And they will tell you that they will oppose any Republican effort to cut Medicare. And by the way, in Trump's budget, he has proposed an $845 billion cut over a 10-year period to Medicare, which seniors don't want. So to answer your question, we are not talking about government-run health care. The Veterans Administration, and most veterans think that that's a pretty good health care system. Talk to the American Legion and the VFW. They strongly defend the veterans' health care. That's government-run. What we are talking about is simply a single-payer insurance program, which means that you will have a card which says Medicare on it. You'll go to any doctor that you want. You'll go to any hospital that you want. And by the way, millions of people today are in networks which prevent them from doing this. So this gives you freedom of choice with regard to the doctors you go to or the hospitals you go to. But here is the main point when we talk about health care. Currently, right now, we got 30 million people, zero health insurance, and many of you and tens of millions of Americans are underinsured with high deductibles and copayments. Is that correct? Yes. All right. So what happens is there are estimates that some 30,000 Americans die every single year because they don't go to the doctor when they should. All right. Meanwhile, we pay the highest prices in the world for prescription drugs. 1 out of 5 Americans are getting ripped off by the drug companies who make billions in profits while charging us the highest prices in the world. And on top of all of that, we spend twice as much per capita on health care as do the people of any other nation. So the question that I throw back to you, do you think it makes sense to spend twice as much per capita as the people of any other nation and be the only country in the world not to guarantee health care to all people?
This audience has a lot of Democrats in it. It has Republicans, independents, Democratic socialists, conservatives. I want to ask the audience a question. If you could raise your hand here. A show of hands of how many people get their insurance from work, private insurance, right now. How many get it from private insurance? Okay. Now, of those, how many are willing to transition to what the senator says, a government-run system? There's 180 million people on private insurance.
All right, let's deal with that, Brett.
And
fair question.
They would be lost, right?
Well,
to your
Brett,
system.
Fair
okay.
question.
Okay.
Good question.
Good, thank you.
And I know it's what the right wing throws out, so let me answer it. All right? Millions of people every single year lose their health insurance. You know why? They get fired or they quit and they go to another employer. I was a mayor for 8 years. You know what I did, what probably every mayor in America does? Is you look around for the best insurance program, the most cost-effective insurance. You change insurance. Every year, millions of workers wake up in the morning and their employer has changed the insurance that they have. Maybe they like the doctors. People are nodding their heads. Okay? So this is not new. Every year. Now, what we're talking about actually is stability. That when you have a Medicare for all, it is there now and will be there in the future.
Senator, let me ask you a question about Vermont, because Vermont tried to have a single-payer program, and in 2014, the Democratic governor abandoned it because he had to raise income taxes, had to raise payroll taxes, and the people of Vermont didn't want their taxes to go up.
No, it's not quite true.
And they abandoned the program. So if you work in Vermont...
Well, you're getting into internal Vermont politics, of which I know a little bit.
Well, I'm sure you do.
I don't want to be here. All right, the governor did a rather poor job, but I think if you look at polling, especially among Democrats, as I'm sure you have, you tell me, strong majority of Democrats and more than a few Republicans want to see a Medicare for all program. What the opponents, and let's be clear about this, Martha. When you are dealing with health care, which is, 18% of our GDP? I mean, we're talking about $3.5 trillion a year. And you have insurance companies that make billions and billions of dollars in profit. Let me give you an example, if I might, of the dysfunctionality of the current healthcare system. Recently, Aetna merged with CVS. You may recall that. Big merger, which in my view will drive healthcare costs up. The gentleman who was head of Aetna's named Mr. Bertolini. You know what he got for putting together that merger? He got a $500 million bonus. Do you think that's how we should spend healthcare dollars?
I mean, I think everybody is in agreement that healthcare needs to be fixed in this country. The question is how. And my question to you was, it will drive up taxes to pay for healthcare. And not just the wealthy will pay for that, the middle class will also pay for it.
Very good.
So how do you justify it? And
all right, Martha, what are you not including in your discussion?
You tell me.
I will tell you. You're not going to pay any health insurance premiums. But look, Martha, Martha.
Whether it's in your income tax or your payroll tax, you're going to pay.
Look, healthcare is not free. You never heard me suggest that we're going to magically...
You just said it was going to be free for everyone.
It's going to be free at the point of when you use it, okay? And you go to... Why are you so shocked by this?
Because someone's going to pay.
Somebody is going to pay.
Who are they? Who pays?
Okay. One second.
Okay,
Relax.
I'm just asking.
Let me talk.
Please.
We'll get through this together.
It's a common question.
Okay.
We had so many email questions.
Okay.
Ask Senator Sanders how he is
Fair
going
enough.
to pay.
I got it.
It's a fair
But
question.
the first thing, let's just say hypothetically.
Okay.
You are self-employed, and you've got a husband and 2 kids, okay? Family of 4. Do you know how much that family is paying today for health care?
Tell me.
$28,000 a year.
Okay.
All right, we're spending $11,000 per person. We are saying to that family of 4, you ain't going to pay that $28,000. You're not paying any more premiums. You're not paying any more co-payments. You're not paying any more deductibles. How's that? $28,000 you're not paying. But does that mean you're not going to pay something? Of course it does. You're going to pay more in taxes.
And do members of Congress who now have gold-plated health insurance...
No, we don't.
Well, they have a special plan that's outside Obamacare. A different plan. Do members of Congress, are they going to do that transition as well?
Damn right. Of course. Of course. Why would you suggest otherwise? But I want to make the point. I want to get back to the point that Martha raised. Look, healthcare costs money. Every other country, or virtually every country, does it in the same way we do education for our kids. Okay, when a kid walks into school, kid doesn't have to take out a credit card, right? It's paid for out of public funds. That's what most countries do. So if you're asking me, if your question is a fair question, are people going to pay more in taxes? Yes. But at the end of the day, the overwhelming majority of people are going to end up paying less for health care because they're not paying premiums, co-payments, and deductibles.
We're going to get into many more specifics. Senator, thank you.